Hello, I'm Dr. Brad Meints from Pine Island, a small town in southeast Minnesota near Rochester, and I'm here to answer the question about what is Advanced Biostructural Correction, or ABC as we fondly call it, and how does it work. ABC is the technique, as I've mentioned before, that frees adhesions between the brain, cord, and the bones that protect them, and it also retrieves bones that are in a position the body can't self-recover. When a patient first comes in, we try to analyze them functionally to see if we can determine whether these adhesions exist and if in fact they have these bones in a position that can't be recovered. We do this by a series of functional tests utilizing the body's own strength and position. Once we find that they exist, the body tends to defend itself in layers. When an adhesion is formed or a bone is in a position that can't be recovered, the body will defend itself by moving other structures and bones around in order to balance itself and to protect the nervous system. When we find these, we have to use a series of physical maneuvers to free the adhesions, and these maneuvers are all done by hand. And we also use these same physical maneuvers to move the bones in a position that the body can utilize or that can recover. So these problems are laid down in the body in layers, and when we treat a person, we have to take one layer of problem off at a time. So the body will defend itself in these layers. In other words, as a person comes in, I'll check to see on that day which adhesions can I find and which bones have been put in a position to defend itself that I have to correct. We then take the patient through these physical maneuvers and correct their body. The body will then deal with what it can after these structures are improved, and another layer may come to the surface, a layer that the body has used to defend itself again from a previous injury. These layers are taken off one at a time until we finally get rid of everything that we can find. This isn't all done in one day. This is done over a series of visits that may take months to years.